The coronavirus pandemic is devastating America's most vulnerable populations. The disproportionate impacts of the pandemic have only magnified long-standing gaps in healthcare outcomes that have been around for generations.
Hispanic women are 40% more likely to have cervical cancer and 20% more likely to die from cervical cancer than non-Hispanic white women.
Latinos are about 1.5 times more likely to develop Alzheimer's compared to the non-Hispanic white population.
African American women, Native American women, Alaska Native women have 3 to 4 times the maternal mortality rates of white women.
1 in 4 U.S. South Asians experience type 2 diabetes or hypertension. South Asians experiencing the highest prevalence of type 2 diabetes in the U.S.
To fully confront these problems of the present, we must first recognize the legacy of systemic and structural racism and injustice that has limited access to health and wealth for people of color.
Persecutions against Native Americans, 2.5 centuries of slavery, as well as a century of Jim Crow segregation and current predatory immigration policies has created profound and lasting inequities for our underserved, at-risk, and vulnerable today.
Over the past decade, there's been more data proving that an individual's zip code is one of the most important predictors of health. Today, we face environmental injustice that sees communities of color disproportionately impacted by air pollution, water pollution, and toxic chemicals. Furthermore, 1 in 9 Americans lacks access to affordable and nutritious food.
The Health Equity Collaborative believes it's time to reform America's healthcare system to safeguard our nation's most vulnerable.
It is not enough to have a commitment to eliminate health disparities. We must implement a national plan to embed health equity and justice in every element of health policy.
We must end the still rampant discriminatory actions against the LGBTQ community. This means barring doctors, hospitals, and health insurance companies from discriminating against patients based off of their gender identity or sexual orientation.
Let us ensure people with disabilities are never denied coverage based on the use of foreign or domestic discriminatory quality-adjusted life year assessments. Our patients should no longer have to worry about receiving a surprise medical bill after visiting a hospital or an emergency room. For too long, drug middlemen have gamed the system to justify their price increases by any means available. We must ensure that rebates and discounts are passed directly to patients.
The future of American healthcare depends on diversity and inclusion. Making real progress in closing the gender and minority gap in STEM is vital and ensures we meet the unique social, cultural, and linguistic needs of patients.
Join the conversation at the Health Equity Collaborative